to this recorded meeting. It's a presentation about the Community Health and Wellbeing Worker. I'm Natalie Hicks. I'm an occupational therapist and the tutor for the Community Health and Wellbeing Worker here at Training 2000. This is a presentation about the course I've made so that those of you that are interested in the course can get a little bit more information. It has been designed more for those that are working in healthcare already. Can get that information, but those of you working in the community may also be interested in this course. Okay, so the aim of this session is to increase your understanding of the Level 3 apprenticeship. This was launched in the UK in September 2022 and it's only run by a select number of training providers at the moment. We're one of only a handful of people that run it at the moment. The learning outcomes of this session are to be able to visualise some of the content of the apprenticeship, which is in the form of knowledge, skills and behaviours, like all apprenticeships, and to be able to identify how this content can be tailored by us to meet your client group's needs. To be able to recognise how the apprenticeship fulfils the National Association of Link Workers education standards, also known as NALWA for short. They're the only professional body for link workers in the UK, but they are actually recognised internationally for the work that they do as well. To be able to identify how to fund the apprenticeship with little or no cost to your service, which is really helpful, because if it's going to cost you an arm and a leg, you really don't want to go forward with that, do you? To be able to describe how the training creates professional level link workers who understand the importance of professional behaviours such as CPD, evidence-based practice and ethics. To be able to explain how an apprenticeship works and what your role will be as an employer. That's quite a lot to cover in this presentation, but I'm going to try and keep it as short as possible. And obviously, as it's a recording rather than a live meeting, you can pause this whenever you want and come back to it, which is why this recording is really useful, really. Okay, here we go. So those of you within the NHS will be familiar with the ARS funding. So the additional roles reimbursement scheme was introduced for the 2019 to 2024 contract DES period. A few months ago, NHS England announced that it has been extended. And they are looking at another 10 years of funding, hopefully, fingers crossed, that whole 10 years and beyond, hopefully, comes through for the ARS funding, because that's brilliant for PCNs, ICBs, and obviously for patients as well, because that's what it's all about at the end of the day. The ARS funding funds the roles themselves, but it doesn't pay for any of the training that the professionals require, which is where we come in. And that's why the apprenticeship is so good, because there is quite a lot of funding for apprenticeships out there. And as you're no doubt aware, there are loads of different ways to employ staff through the ARS funding. So they can be employed with the PCN directly, with a lead practice. They can be working based in the community, or they can work in a specialist provider such as a CVS. And all these different ways have their benefits. So it's what meets the needs of the local community or client base, really. So with the Level 3 Community Health and Wellbeing Worker, we're interested in all three of the personalised care roles which are funded with the ARS, and all three of these roles can be trained with the apprenticeship. So I'll segue straight into who is the course for. So the course is called the Community Health and Wellbeing Worker Level 3, but many people call it the Social Prescribing Apprenticeship. And it is ideal for social prescribing link workers, but it isn't just for social prescribing link workers. It is ideal for other personalised care roles that have until now not had any recognised training. So that is the Community Health and Wellbeing worker, obviously, as the title of the course. Care coordinators, so not the care coordinators in CMHTs that are OTs, social workers and mental health nurses, but the care coordinators based in GP practices or in the community, health coaches and much more, like your family wellbeing workers. It is vast, you know, who we can train really with this course. If you're unsure as to whether that role is covered under this course, please just get in touch. You know, it is really vast who we can train under this course. It's absolutely fantastic, really, really wide. So the course content. So it's really important to ensure that the course fits the needs of your service. So by design, the course has been created to be flexible. So that allows trainers who are experienced in this area to be able to create more specialist courses for specific needs. So I'm an occupational therapist, and so that means that I've got the knowledge to be able to tailor the course to your needs. So if you work specifically in a children and young people and families background, then your needs are going to be quite different to those who work in a GP surgery and are working with all different needs, or someone who works purely with older adults. So with children, the safeguarding needs are really different, or the communication needs or ethical and legal frameworks. Or if, for example, you're working with someone with addiction, you know, your like personal protection needs are going to be really different, and again, the safeguarding needs. So it's about ensuring that we're meeting your needs with the course. So the course can be really flexible. It's you know, being an OT, I'm really aware of ensuring that we're meeting your needs with the course as well. And I will show you how flexible it is a little bit later in this video. So the course has 10 set duties, which I suppose are a bit like modules, but we call them duties in an apprenticeship. Teaching is performed over a 12-month period, and after that we go into the assessment. Every 12 weeks we have to do a review, so we try to do it every 10 weeks to try and get in more reviews, and there are one-to-one. As this course is an online course, this is done over Teams, so they'll be done initially. It's myself talking to the learner, and then at the end I need to speak to yourself as the employer, because obviously your voice is really important within this, because if you're not happy, or if you think they've got some learning needs, or you want them to hit certain goals, so we need obviously your voice in those one-to-one reviews as well. And if you've got any feedback, obviously you don't need to wait every 10 weeks. You can get in touch anytime. And with a lot of apprenticeships, actually, you have a tutor, an assessor, and a skills coach. You can be dealing with 2 or 3 people in traditional apprenticeships. And with this one, it's really good. Because you're only dealing with me, because I do all of the assessing, all the teaching, all the coaching. So you only deal with one person. So if you've got an issue or you want to talk to someone, you have my excuse me, I have a works mobile phone, so you can text me, WhatsApp me, you can message me on Teams, and you can contact me and I'll contact you back, so you know who that port of call is. And that's really good, so you don't need to think, oh, well, who is it I need to speak to about this? And with me being an OT as well, you know that I have that knowledge and background about the course as well, and about what your needs are as well. Right, sorry, back to the course content. The taught content is 3 hours a week online. So It's every Wednesday morning, 9:30 to 12:30. Now, it's not, or I'm not saying that I'm going to be, having them strapped to Teams for that length of time. Within that 3 hours, they'll be writing a reflection of what they've learned. There will also be some group work in that time as well, and some research. So that 3 hours isn't just me doing a lecture. That there's quite a lot in that 3 hours as well. There's also another 3 hours of training time as well within work. That will include them writing their standard reflections that they need to write anyway. That'll include supervision. That'll include the research they need to do. It'll include shadowing work that they do. It'll include training courses that they go on, and that isn't that they have to do 3 hours every single week in, week out. That's an average over the year. But we will talk about that more when we have a proper discussion about the course, if you're interested. But it is to make sure that they're learning enough to meet your needs as an employer, so that they're actually going to get this course and this qualification, and that they're going to understand what they're doing. Okay, so moving on to the actual 10 duties themselves. So as I said, there are 10 duties in the course, and these are the 10 set duties in the course that we have to cover. You can find out more information about them by visiting the Institute for Apprenticeships website. And please email me if you'd like me to send you a link, or I can send you a copy of that information that they produce. It is quite in depth, and it is really useful and really helpful. So I'm going to go through and I'm going to give you the official descriptions of each duty. And with some of them, I'll try and translate that into what that means, or give you a little bit extra as well, because some of the descriptions don't actually tell you what it actually means as well. Okay, so duty number 1 is preventative approaches. So use preventative approaches to promote the health and well-being of individuals, groups and communities, addressing the wider determinants of health and causes of ill health. So we will research wider determinants of health and find out how this impacts on people, really. So it kind of is what it says on the tin, that one. And duty number 2 is support communities. So help communities to build local resilience and identify strengths, capacity and resources that support their health and well-being. So they're going to look at different community organisations, and the ones that you're working with, they're going to assess them. They're going to also look at strengths and asset based things as well. Can't remember the word. So that it's about working within them community based organisations, really. Duty number 3 is advice and guidance, to provide informed advice about local services and projects that support health and well-being. That doesn't actually explain anything about duty 3. So duty number 3, it's hard to explain, but we actually have to go in depth and find out about what statutory organisations are, how they're funded. So that's understanding things like the police, schools, museums. There's quite a lot to duty 3 that's quite complex, but that doesn't really explain it at all. Yeah. Managing referrals is duty number 4. So how to manage referrals from a range of agencies and professionals, and also through self-referrals. So those are the referrals that come into the service, but also referrals that are going out of the service, so how they refer on. So when referrals come in, what do you do with them? So you do assessments and things like that. And also you need to make sure that those referrals are suitable. Things like that, how you triage them, that sort of thing. It is more complex than it sounds. It sounds dead easy. Duty number 5, apply evidence-based behaviour change tools to help people find practical solutions for better health and wellbeing. So with that one, we're looking at motivation, empowerment, person-centred approaches, learning. We're looking at the zone of proximal development. We're looking at how we can empower someone to make change without hand-holding too much. How you support someone to do something without doing it for them. So there's lots of discussions in there. It's a really interesting one, that. Lots of psychology in there and sociology. It's a really good duty, that one. Duty number 6 is strategies and policies. Implement national and local strategies and policies that promote health and wellbeing. So we'll be looking at like the NHS long-term plan, the NHS staffing one that's just come out. So loads of policies that are out there and how we support them. Understanding the importance of health strategies, policies and interventions to improve health and wellbeing. So why we have them, what they do, that sort of thing. Really important that those things and how that kind of creates a healthy community as well, and how that ties in also with your health inequalities as well. Duty 7 is communicate public health messages and information to promote health and wellbeing at individual, group and community level. So we'll have a look at the Public Health England public health messages. There's loads of those. You get all the posters and things like that. So we're going to have a look at those, see what we think of them. There's quite a lot to that. We're also going to look at understanding barriers to communication, what barriers we have, what barriers our client group has, how we can improve our communication. We're also going to, throughout the course, look at our written communication, what we can do to improve it. We also look at our English skills and our digital skills as well to improve that. And then we'll be looking at different ways to communicate with people. So is it better to communicate on Twitter, better by phone, email, letters? So communication features throughout the whole thing as well. So there's lots of threads they all thread together in different ways actually, which is quite nice. Duty 8 is data and information. So quite obviously managing data and information, which is legislation and protecting data and information governance, and you know that the law with that, which is very important. But also we have to contribute to the evaluation of projects and services. So we're going to look at a service evaluation as well, which is really good. Because as professional healthcare, as healthcare professionals, service evaluation and service improvement is part of our role. So we need to instill that as one of their roles as well. So we'll be looking at service improvement and also looking at health improvement. So looking at the the outcome measures and looking at how they work and which ones are best, for your service. So we'll be looking at those as well as part of data and information too. Quite a lot in data and information. And of course, we don't leave data and information to write at the end. We do actually look at that throughout. Duty 9 is legal and ethical frameworks. operate within legal and ethical frameworks that relate to the promotion and protection of the public's health and well-being, which is quite obvious. And duty 10 is development, which is take responsibility for personal and professional development in line with organisational protocol, the importance of CPD, appraisal and training, and also creating their portfolio of evidence. Just one moment. So as their portfolio of evidence is so vitally important, because it's part of their endpoint assessment, and also generally learning CPD and the ability to reflect, all being really important. I've actually positioned this as the first duty that we learn. So and then I also thread in legal and ethical frameworks and data information as well, but I don't finish those two duties, so I do that right at the beginning. So we're looking a little bit at ethical frameworks, a bit of consent, data protection, safeguarding, as well as the personal development is kind of like the first module. And then I finish data and information and legal and ethical frameworks as proper modules at the end. But I think that they're really important to do right at the beginning to give a really good basis. So that's how we start it, and then we go on to the preventative approaches. So that's how we start off. We start at the end and then go to the beginning. But the portfolio is really, really important. So we need to lay the groundwork for that portfolio at the beginning, so that they can then, throughout the rest of it, continue that portfolio. So I'm just going to give you an example of how content can be tailored. So this is knowledge 5. So this is part of duty 1. And this has just got quite a short description, so it's quite easy to explain it. So health inequalities and how these impact on physical, mental and emotional health and well-being. That is the whole description of that duty, of that that knowledge for that duty. So to break it down, so health inequalities. What are health inequalities? So obviously I have to go into detail on what they are, and then what the impact of them is on physical health and well-being, mental health and well-being, and emotional health and well-being. Now, this knowledge doesn't tell me how to teach it and whose health and well-being it impacts on. So it's really flexible to deliver it. So I'm able to ensure that it's delivered in a way that your learner studies the health inequalities that are relevant to your area of business. So if you're a GP practice, then it's important that we look at general health inequalities and in your local area as well. So we can look at researching that for, in your area and comparing that to those nationally. But if your service works with a high percentage of older adults, it'd be really helpful to look at that data of older adults in your area and how deprived it is. So we look at real-time data from the Department of Health, Improvement and Disparities, but we tailor it to the needs of your service. But we make sure that it meets the needs of that learner and it's working on something that they're interested in and that will work in their job role, really, because there's no point someone who works purely with older adults looking at something that is related to children, as it isn't going to benefit their apprenticeship. So it must benefit their apprenticeship. It's pointless otherwise, isn't it? So yeah, it is really nice and loose, so that we can really tie that into their job role and make that benefit. So if you're a wellness business and you don't work necessarily with you work with people that are purely working age. You don't really want to know about children or older adults. So again, it needs to look at your business needs. So it's all about finding what is right for you, and you as an employer can help me understand the needs of your business as well, and like myself and business development can have that meeting with you so we can find out what your needs are as well. So the apprenticeship itself is 12 months long, during which time the apprentice will study with myself, the tutor, and they'll be taught the 10 duties and build up their portfolio. So after this time, they will get ready for their assessment, which is known as the endpoint assessment. And there are 3 parts to the endpoint assessment, and they need to pass all 3. Okay. Oh, yeah, there's the endpoint assessment bit. Sorry, missed that bit. Okay, so during the 12 months of teaching, they need to complete their portfolio. But they also need to study their maths and English. So if they don't have a level 2 in maths and English, they need to make sure that they get that. So we can provide that as a service. We provide functional maths and English, so we don't do GCSE. Functional maths and English is a lot more appropriate to the workplace. So at Gateway, they need to submit their portfolio and pass their maths and English. And at the endpoint assessment, they have a discussion with their portfolio, which is why they need it. That's a nice little pictogram there. So at Gateway, they must prepare and submit their portfolio and also have passed their maths and English. Otherwise, they can't proceed to the endpoint assessment. So they have 3 months within Gateway to get that, and also to do revision and get themselves ready for the endpoint assessment. So they have 12 months of teaching and 3 months at Gateway to get everything together. We can extend the teaching if needed, but obviously we would rather not do. So there are 3 parts to the endpoint assessment, and as I said, they need to pass all 3 parts to complete the apprenticeship. So there is a multiple choice test, a demonstration of practice, and a professional discussion, which is underpinned with the portfolio of evidence. You can get information about the endpoint assessment in detail from the Institute of Apprenticeships. But again, if you want this sending to you, please let me know, and I can email that to you as well. So the multiple choice test is pass or fail. So they need to reach a certain amount to pass it. And they're going to be tested on areas which they've learned during the 12 months. If they fail, there is a retest cost, which the employer needs to pay. The apprentice themselves is not allowed to pay for it. It has to be paid for by the employer. So during the 12 months, I will be doing regular multiple choice tests to get them used to that format. And there'll be multiple choice tests during most lessons and at the end of most of the duties. And there'll also be embed knowledge tests, which will be 2 or 3 duties together to try and get that knowledge in the head. Otherwise, it's easy to forget things. And there'll also be mock multiple choice tests during the Gateway phase. So they're going to be well prepared for this going forward. The next phase is a demonstration of practice, and that has 3 test stations. And this is pass, fail or distinction. And again, as it's an online course, these stations are going to be online on Microsoft Teams in 3 separate rooms. And we will do mock demonstrations of practice during the course. And it'll be online in that same format, so it becomes familiar, and it also embeds what we're learning as well by doing these demonstrations. And the final one is a 60-minute professional discussion, which is underpinned with a portfolio of evidence. And so they've already submitted that, and that will be sent to the independent assessor. So they're going to look at the contents of the portfolio and identify discussion topics, and have a chat basically about that and ask questions. So this is pass, fail and distinction. So depending on the results, they will either get a pass, fail or distinction at the end of the apprenticeship. So we've got an online e-portfolio system, and it's really easy to use. And it's a very popular e-portfolio system that loads of apprenticeship companies use. And employers also have access to this system, so you can see what they're doing, what's due, if they've got loads of tasks they've not done. And we can put tasks on there and give them due dates, that sort of thing. And after each online teaching session, I put them the task to write a reflection of that teaching session, and I do give them time at the end of that session to write that reflection, so that they're not having to do that during work time, so that they should be able to do that in my time. We also give you training to use that system as well, and we give the apprentice training to use the system too. And we'll provide them with support between the end of the apprenticeship and before the endpoint assessment, so during that gateway phase, so that we get them ready. We don't want to rush them into it because we don't want them to fail. We want them to pass. So I'll be there holding their hand all the way through, because we want them to pass, don't we? Okay, so the National Association of Link Workers have their education standards. And this is a link to them. Again, I can send you the link. On that link, they have this picture, but they also have a booklet of their education standards. Again, let me know if you want that email in. If you email me and say, just email me everything, I can email everything to you, that's fine. So if you see here in the bottom right hand corner, it does say apprenticeship. They have their own training programs, which is what's in the bottom left hand corner. They recommend lived or learned experience because that gives people lots of understanding. But yeah, the apprenticeship here is a recommended route by themselves, which is brilliant. Now, these 8 professional behaviours I've identified, they're not the only professional behaviours that the individual is going to walk away with. They're going to walk away with loads and loads and loads. These are just 8 that have come to mind as I've been writing this presentation. But they're going to end up with so many professional behaviours and great skills from this apprenticeship. Continuing professional development, that's vitally important if you want a health professional working for you. All registered health professionals need to do continuing professional development, and I think really that these guys should be no different. I know they're not registered currently, that may change in the future, but continuing professional development, it's vitally important for keeping people safe and ensuring that they're the top of their game. Safeguarding, we need to keep people safe at the end of the day. We need to be seen to be the best at safeguarding in health care. And yeah, there are people that slip through the net, but the better we are at safeguarding, the less those are going to slip through. The importance of consent, implied consent, it shouldn't be accepted, and we need to improve that across the board. So importance of consent is really, really important. And service evaluation and improvement. the more health professionals that are trained in that, the more improvements we can get, because we all know that cuts are getting deeper and deeper and deeper every year, and getting funding for things is getting harder. So we need to be more aware of service improvement, evaluation, and trying to save money where possible. So the more of us that are aware of how to do these things, the better, really. Data handling. There's fines if people don't handle data properly. So it's so important. So they need to have data handling skills. Legislation, they need to abide by the legislation, and I go into great detail on the various legislation that they need to know. Mental health legislation, the Care Act, how to protect themselves. There's so much legislation, but it's really important. Ethical frameworks, we have discussions about ethics, quite a lot of in-depth discussions in morals. We talk about medical ethics. I think we go more into ethics in this than we did in my degree, actually. But it's really good to talk about ethics and to be ethical healthcare professionals. And lastly, communication. So, talked about communication before, but the better we can be at communication, we ensure that we're getting our patients' wishes correct, and that is all for the good of our patients, really, and for ourselves, because obviously we don't want to do anything wrong, do we, at the end of the day? So funding. Yeah, I go straight into a big question. Oh, is your employer's salary bill over 3 million? That is a deep, big, massive question, isn't it? So if it's over £3 million, the apprenticeship levy pays all costs. You don't have to even worry about funding. It's just done. It's taken care of. So the apprenticeship levy, if they've got over £3 million in bills that they have to pay, salary bills, they just have to pay into this apprenticeship levy, and it's like a pot, and it just sits there until an apprentice comes along and they go, oh, there you go, there's the money, and that's it. If they don't have a salary bill of 3 million, then they're not paying into that pot, which means they don't have that apprenticeship levy. So what happens is they then have to contribute 5% towards the cost of that apprenticeship. So that's £350 at the moment, because it's £7,000. And the other 95% is paid for by the government. If you still don't like the idea of paying £350, if you're a very small organisation and £350 is a lot of money, you can get a donation from a business that has a levy pot. So some businesses have such a big levy pot that they have money left over from that levy pot, and they can donate up to 25% of what is left to you. But you would need to have the full 7,000 off someone. So we have contacts with businesses that have the levy pot, because they're paying for their apprentices. So what we can do is we can contact those businesses for you and ask them if they will donate. So please ask us. We can speak to these businesses for you. It's not a problem. Business development are brilliant. They are cheeky, and they will do this. You know, if you can't afford the £350, but you really want the course, then our business development team are brilliant. So they will go and ask. I can't guarantee anything, but we can ask them. Can ask business development to ask. It's no problem. And then also you can ask other businesses as well. But yeah, it's always worth an ask, isn't it? So what is an apprenticeship? How does it work? I must admit that until I came here and had this job, I had no idea. My dad's actually a mechanic, and he has his own business and has done since I was a little girl, and he's had loads of apprenticeships. Loads of apprentices, sorry. My brother did a mechanic apprenticeship, and I had no idea. Yeah, a little bit of an idea, but you know, I didn't really understand. And so actually it took a lot of learning for me to understand what an apprenticeship was. So I think it's really important for us to spell out what an apprenticeship is, because so many of us don't really have lots of misconceptions or preconceptions or misunderstandings. So an apprenticeship is a real job with a contract where you learn, you gain experience, and you get paid. There are hundreds of apprenticeships to choose from in a wide range of different occupations, from data science to business or construction. And then obviously in healthcare, which is brilliant. So apprenticeships are available from level 2, which is equivalent to GCSEs, all the way up to more advanced apprenticeships that go up to degree level. And I believe they even go up to master's level now. We do them up to HND level here at Training 2000, which is brilliant. This particular apprenticeship is called level 3, which is what is known as an advanced apprenticeship, and that's equivalent to A levels, which is brilliant. I didn't know that you could get apprenticeships that were equivalent to A levels when I started. I think that's just brilliant. But I just don't. It's like if I'd have known that, I probably would have been pushing like more teenagers to go and do this. I just think it's great. I just think it's wonderful. I think it's great that there's so many more opportunities now out there. You could do apprenticeships from 16 plus, but what I didn't know is that there is no upper age limit. So that means you can start an apprenticeship at any age and at any stage of your life. I just assumed you had to be 16 or 18 to start an apprenticeship. That's not true. So anyone can do an apprenticeship. There is classroom and work-based training. Oh, where did we go? No, come back. I don't know what happened there. Where did it go? Thank you. It came back. We're okay. So whether you're just starting out or want to change or even looking to progress, you can do an apprenticeship. So yeah, it's brilliant. It's a great opportunity to do an apprenticeship because you get to do the job and do the learning at the same time and get paid. So it's a great idea. Yes, so where was I? Classroom and work-based training, sorry. Yeah, so the 3 hours of classroom training and 3 hours of work-based training that are done, which work out over the year to be enough. The 3 hours of training or learning is known as off the job, even though you do it on the job, but we do explain that to you when you sign up and we go through all the different details. It's because I've used my mouse. I don't know why I'm doing that. Yeah, there we go. And there's 3 hours of teaching, 3 hours of additional learning. There we go. Right, sorted. It's because I touched my mouse. I won't touch my mouse again. Okay, support your employee in the training. That's what your role as an employer. You need to support your employee in their training and provide a nurturing environment, offer shadowing and training opportunities, which gives you those 3 hours each week. Attend the review meetings, but as I say, you only need to attend at the end of those review meetings. We're not expecting you to attend the whole meeting because obviously you have a business to run. We expect you to support the development goals. So as part of their apprenticeship, we will they will have SMART goals. We call them SMARTY goals, which is SMART with impact on the end. So we expect you to support those development goals and help them meet them as part of their employment. Provide supervision. And by that, I mean their clinical supervision. That's your responsibility. We can help support group supervision, but we would need to discuss that. And we would expect you to complete regular appraisals with them as well. So there are many benefits to you as an employer for this apprenticeship, but I've picked 4, which I think are the most important ones. Recruitment and retention. I know at the moment that recruitment is really tricky. Trying to find someone that is the right person for the job, who can do the right number of hours, it is really difficult. But you can recruit someone who doesn't quite have the right skills, but can do the job and has the right attitude, and we can train them up to a really high standard in 12 months. And then you will have that right person. There's also the social mobility aspect of this recruitment. So it's enabling you to employ someone that has that life experience. So maybe they've been a carer for someone, but they don't have the qualifications to prove what they know. This apprenticeship will give them great opportunities and will enable them to learn and be a great employee. And retention wise, staff who are provided with training are more likely to stay in a role, or are more likely to want to go to a role where they get great training, because they're not going to want to leave to go somewhere where they're going to get that training. And we can also offer in the future apprenticeships with management opportunities and things like that for you as well. You're also future-proofing your staff as well. So this high standard of training is going to future-proof against any changes to the training requirements of social prescribing link workers or community health and wellbeing workers. At the moment, they're not required to register with any professional body, but if in the future there is a requirement, there will be CPD requirements and certain requirements that they'll need to meet. This course will meet all those requirements and they will be ready for registration. So you'll know that you won't need to do any training. And this course is client group specific. So we know, we can meet the needs of your client group and ensure that your member of staff is trained to meet your client group's needs. So that they're not going to be training about children when you work with older adults or vice versa. So we're going to make sure that the training meets your specific needs. And also the training is in depth. We've been through a little bit of the training. You've learned a little bit about it. You know how in depth it is. I could talk for hours and hours about this course. And you've seen just how in depth it is, and I've only touched on the surface of it. If you've got any questions at all about the course, or you want some of the information sending to you, please feel free to contact me. I'm tutor, skills coach, assessor. I do all of those bits and bobs on the level 3 apprenticeship. I'm also a HCPC registered occupational therapist as well. My email address is natalie.hicks@t2000.co.uk. Alternatively, you can speak to someone in our business development department, and they're at businessdevelopment@t2000.co.uk, or you can continue emailing the individual that you have been emailing already. And I would like to thank you for taking the time to listen to this quite long presentation. And I apologise for it being so long, but I just wanted to make sure that you had the opportunity to get all of the information that you needed. Yeah, I hope that the course meets your needs. Thank you very much.